Good morning. My name is Dr. Vidyut Jain. I am practicing in Indore, Madhya Pradesh, India. Today I am going to discuss something about cardiovascular diseases in the chronic kidney diseases. These two diseases are two set of diseases by themselves are very sick status. A patient who has got chronic kidney disease has got lot of morbidity and increased mortality. In addition, if he gets cardiovascular complication, then the problem is manifold. So, what are the common problems which we see in the chronic kidney disease ultimately leading to the cardiovascular morbidity? So, one most common is hypertension, second is aggressive atherosclerosis leading to coronary artery disease, then heart failure and sudden cardiac death. All are equally important. So, hypertension will be always aggravated because of high creatinine value and many metabolic disturbances which causes this hypertension which gets uncontrolled during management of the chronic kidney diseases, for which you will have to take care of the salt restriction, fluid restriction, appropriate drug like ACE inhibitor, ARB as per the creatinine and potassium value, and later on if patient has got some disease which is related to pulmonary vascular disease like renal artery stenosis, that can also be tackled differently. Now, more common problem is enhanced atherosclerosis. Enhanced atherosclerosis occurs particularly in the chronic kidney disease due to multiple factors, which may be ongoing dyslipidemia, diabetes and immunomodulator and then inflammatory marker, all this lead to the enhanced atherosclerosis. In addition, the coronary arteries will have more calcification, so difficult to manage them in future by intervention also. However, we have a option whenever needed, you can go for optimum medical therapy, or sometime you may have to do angioplasty, but it has got its own limitation, and couple of patients will require coronary artery bypass surgery during CKD. At that time, you have to take care of that patient should not go into acute renal failure or any other metabolic problem. After that, the more important and one of the important thing is sudden cardiac death. Many of the patients who are on chronically hemodialysis or non-dialysis and a high creatinine value and high potassium can lead to the sudden cardiac death, which is very detrimental. So, one should be very importantly monitoring about what are the causes which patient can go to sudden cardiac death. That may electrolyte imbalance, sometimes T-wave vulnerability, sometimes there may be uremic toxin, all this leads to the problem of the sudden death, which has to be prevented by appropriate medical management or sometimes device management. Some patient will definitely go into heart failure because of the increasing hypertension, metabolic problem, they will go into heart failure. Here the management will remain same, except in place of ARNI you can use the drugs like Vidyut, because that does not cause a rise in creatinine and neither rise in the potassium. So, that is an additional thing which you can possibly offer to the patient of the CKD and heart failure apart from the guideline directed management. So, this is the in short about the management of the cardiovascular problem in the CKD. In addition, I am going to give a talk on an orphan topic which is known as idiopathic pulmonary artery hypertension. Idiopathic pulmonary hypertension is a very rare disease, something like 100 in 1 million patient, but our armamentarium had been very poor and the patient was suffering and the morbidity was high and the longevity was hardly 2.7 years if untreated. Even if you try to treat, the longevity goes up to hardly 9 years, but now in last 30 years we have seen the development of various drugs, including drugs like phosphodiesterase inhibitor, then we have got a drug like endothelin antitoxin, then we have got drugs like prostacyclin. So, now we have got prostacyclin analog which also helps in the management of the pulmonary hypertension. So, patients of pulmonary hypertension should be picked up in an early stage. They should be given one or more drug and sometimes triple drug to take care of their morbidity and reduce their mortality. So, this particular topic although is a rare, but at the same time the disease is disabling and needs attention of all our physicians and pulmonologists and cardiologists to give them best treatment as far as possible. Thank you very much.